If you're a man out there and you've heard about how important testosterone is for you and all of its benefits and all of its downsides if it's too low, I'm telling you right now, you don't know as much as you need to know. And this is the episode for you. Welcome, friends. This is Barry Napier. I'm here with Dr. Angela Yeagley.
Hello.
It's time to elevate and thrive, and we're going to bring some love to all the guys out there who need to know more about testosterone. Because it's for guys, it's like your go-to hormone. And a lot of dudes are walking around and they're hearing a hormone talk and they're thinking that's for the ladies.
You mean just the word hormone?
Yeah. They hear the word hormone and they think, oh yeah, ladies have hormones. No, bro, you have hormones too, buddy. You have a lot of hormones. And the hormones that we need to talk about, that you really need to understand, is testosterone. And guys are complex hormonally as well, right? I think that it's easy to say, oh, guys are simple, women are complex. Guys are
that is true. Unfortunately,
like, women are very complex, magnificent creatures, and they are complex and magnificent. But so are guys, all right?
Absolutely.
And so our hormones they need work, they need help, they need attention too. And this is the episode where we're going to talk about really the number one hormone, though, that you should pay attention to as a dude, which is your testosterone.
Absolutely. I think that, something we were talking about before we started, that if you're a guy and you have never seen your levels, like, you should just go right now.
Just be like, just pull the car, like, and then, like, drive here right now as soon as you listen to this, and just pound on the door and be like, I need my 2 levels checked. I need my 2 levels checked.
Yes, it's that important, I would say.
Don't drive to one of those scammy men's health clinics, FYI.
Yeah. Well, and
we'll talk about that later.
Yeah, I would agree with that 100%.
You don't have to come here, but if you don't, you're a fool. Or you don't live here. That's okay.
Then go to a holistic.
Just go to a holistic
doctor. Yeah.
Yeah, but for sure, most guys that I talk to, if I just said, hey, how much do you weigh? They could tell me that. If I said, how much can you bench press? They might be able to tell me that. How much can you deadlift? They might be able to tell me that. But if I said, yo, what's your T levels at? Most men could not tell you that number, but they should actually know.
They should know. Yeah. So let's, I think, talk about a little bit of the signs that you might have low T.
Yeah. So what are the signs of low T?
So
there's a lot. They're all bad.
Yeah.
And there's a lot of them.
Yeah.
And you don't have to have all of these to have low T, FYI.
Absolutely. Yeah. And in fact, you might maybe you're borderline. Like you're like, overall, I'm doing pretty well. Yeah. Could I be optimized? Yeah.
Maybe.
So most men, I think, probably are going to associate low libido probably as a number one. They're like, but that you don't have, it doesn't have to be that, right?
Yeah.
There can be other things like lower energy, lower just drive overall to get things done, right? Noticeable decrease your muscle mass is changing.
Or in trouble, building or sustaining muscle mass, even though you're working out or whatnot, could be a sign.
Yes. As well as sometimes it can be sleep disruption, mood disruption. So meaning like you could be low mood. So we might call that sadness, or again, unmotivated.
Depressed, low, no drive.
Yes.
Just don't care about things as much.
Right. Which we might call a depression, but maybe not. Maybe we just say, hey, just not feeling life right now. Yeah. But it can contribute to anxiety. So there are other kind of like psychological, because the brain needs testosterone, right? That can be contributed also to that low T.
Yeah. I mean, if I was to summarize, it's like, you could be fat, slow, and just grumpy and sad and weak.
Wait, this is how a man pursue this. That's right.
Give me the T-shot.
Well, let me tell you a couple of other things that actually maybe just is in the research that you wouldn't necessarily feel or know, and that's your recovery time. So actually, if your testosterone is lower, your recovery time, whether that's like healing from an illness or an injury, or workout, like post-workout, right? It's going to be lower. It's going to be slower.
Yeah, there's a huge T problem with guys, right? If you look at the stats, it's very fascinating. There's a decrease in testosterone over the last 50, 60 years, just across the board for men. Yeah. There's a lot of different theories as to why that might be. I'm not going to get into any of those right now, but suffice to say that generally speaking, unless you're really optimizing your overall life, chances are as a guy, you are on a sliding downward scale with your T levels. And that can happen pretty early. It can start happening in your 20s, into your 30s, definitely as you get into your 40s and 50s. And especially, you look at different factors like stress, environment. You look at different lifestyle components like alcohol, lack of sleep, all these different things. All of even work, like you could be an exercise fanatic and you could be working out too much and have abysmally low T level. I've told that story before.
Right.
When I was in the best shape of my life, and I was CrossFitting like 24 hours a day, 7 days a week, always CrossFitting. I was very shredded, and also had the T levels near the end of that 5 or 6 years of like a 95-year-old man. So point being, there are a lot of negatives that come for dudes when your T levels are low. And you might have some or all of these and not know it because you've just been living life and you're not necessarily thinking, oh, I have a hormone imbalance issue.
Yeah, absolutely. Or you might think, like, I am just living life. I'm busy, right?
I'm stressed.
I've got kids.
This is how it is.
Yeah. This is how you're supposed to.
Welcome to my 30s.
Right.
Welcome to my 40s when I'm steaming pile of poop.
I'm glad you're bringing this to life.
I'm just getting all the real stuff people say.
Keeping it real. That's right.
You want fake? Go somewhere else.
So say you're sold. You're like, okay, I'm getting testing, right? So I would recommend, got to get in. I want to see your free testosterone is the most important because that is what is your active bioavailable levels of your testosterone. When you get a total, it is showing what is a combination of an active and inactive. So your total can look great, actually, or maybe okay. You're like, the range is pretty huge, right? It's like starts at like 240 and then goes all the way up to 1100. So your total's like, oh, it's 600. It's not that bad. Then you get your free and you're like, it's bottomed out, right? So you have to at least have the free or the bioavailable testosterone. And then if you want to combo in the total, that's fine as well. Then I want to see other things. I want to see DHEA. These are adrenal. DHEA turns into testosterone in your body. I want to see cortisol, that's one of your stress hormones. If we're going to do testosterone therapy, or if you tend to kind of carry weight in your chest, I want to see an estradiol on an estrogen level.
Yeah, so if you are a man and you're getting, you have like a lot of fatty deposits in your breast chest area, right? That is oftentimes a sign that there is a hormone imbalance with low T and high estrogen.
Absolutely. And
creates that very specific.
Yeah. And why it's like, how does that happen? Testosterone will convert itself into estrogen.
So part of what we're looking at is if you end up having low T, some of the tests that you're talking about, we're looking at different precursors, different interactives. Now we're kind of looking at more of a holistic picture on all these other hormonal factors that lead into T and the utilization of T and various other stuff. So that's why those other things are great. And generally, you're not going to get any of that stuff when you're just going in for your physical, right? So even if you're going in for your regular physical and it's just like, yeah, I'm going in my MD, the testing that you're going to get oftentimes will not be the free testing. Oftentimes, again, you might be in a range and somebody is like, hey, you're good to go, man. You're like 3.
Oh, yeah.
You're like 300, 400.
They're just doing the total.
You're not even close to the bottom. Got a couple hundred to go. I mean, meanwhile, you're basically like 0 T, right? You're in a spot where you absolutely could benefit from some kind of therapy. So when we look at these testing, we do a much more comprehensive, more in-depth test. So whether you're coming here or going somewhere, you have to look for all of these other cofactors when you're trying to understand what's happening with your body.
Absolutely. And then once I'm treating you, I'll add a couple lab tests. Like I really want to see your prostate levels. That's the PSA. So we keep an eye on that. Very rare that testosterone will irritate the prostate, but we'll start seeing it climb the PSA if it does. So that's another thing we check. And labs for tracking, I'll just add it in since we're talking about labs. I want to see something called a CBC because testosterone, one of the side effects is thickening. So, but easily treated with donating a little bit of blood. So that's good. So we can manage that pretty easily. So I want to get a baseline CBC as well.
Now, would you say that, so when we got some of these tests back and all this other stuff, essentially, though, when we're looking at the testosterone levels and we're looking at these kind of free, when it comes to the range, where would you say people really ideally would want to be? Because I think there's also maybe some guys out there have heard of like, oh, wait a thing, the testosterone, wait a minute, are we talking about doping? Are we talking about like just getting like super jacked Schwarzenegger style, and I'm like just popping myself full of, you know, testosterone mixes or whatever and hitting the gym and just getting roided out? But we're not talking about.
No, we're
That's
keeping,
like hyper.
that's hyper. Yeah. So we're talking about like getting your testosterone levels into the physiological, range where like at a level where you feel good, you notice a difference, right? So you've been diagnosed with low T. All right, our goal is to move that number up. And so it does not have to be at the top end of the range. So like you mentioned, why you might want to consider avoiding like the T clinics is that their goal really is to just get you to the top. That's their goal. They're going to super dose you because, I don't really understand why. I don't know if they think that's where everybody's going to feel awesome. I'm here to tell you it's not true. I've gotten those guys here that they're like, this is freaking my body out and I don't actually feel any better. Like, so we want a good, healthy range, along with how you're monitoring how do you feel, right? So it doesn't actually have to be at the top. You could be mid-range. You start low, you just make it to the middle and you're like, you know what? I'm feeling really good. We don't need to push it past that, actually. You're going to get all these other benefits from the testosterone without pushing you all the way to the end because there are potential side effects too, right? So we're always trying to find that nice balance, the sweet spot, right? In the middle, like where is your sweet spot to like for you feeling amazing and not having side effects from testosterone?
Exactly, because anytime we're starting to bring in something that's outside of the body in this way, like a bioidentical hormone replacement, if we're talking, hormone replacement therapy, there's a both an art and a science to it. Yeah, we're trying to hit that bullseye, and we don't want to overshoot because if we overshoot, there can be down effect, negative side effects based off of this testosterone. Things, all kinds of stuff. Right? So like, what are some of the
Okay, so here are the things we have to watch for. So once you start testosterone, within 6 weeks, we're going to recheck. And what I'm looking for, I'm going to make sure that your testosterone isn't converting a ton into estrogen. So that's something we have to keep an eye on because we don't want that happening. It's not the bad. Men don't tend to feel that great when their estrogen is higher. And then you also get that fat deposition in the chest, right? Colin, yeah. Yeah, right. So
don't want no loops.
Then we're checking the prostate, making sure again it's not getting irritated by it. Most men are just fine in that area. Really, probably the biggest potential side effect that is the most common is that blood starting to thicken, and so that's specifically like the hemoglobin and hematocrit. Your red cells start thickening up a little bit. Like so, when I pull it, they look high, and that is a recipe for some cardiovascular risk, right? You don't want to walk around with thick blood. It's just not good for you. But luckily, again, if it happens, and you just happen to be one of those people that testosterone tends to do that to you, then we complement it with you donating blood. And sometimes we end up, if you don't actually need that much blood taken out, based on like your iron levels, then we specifically will do something called a therapeutic blood draw. And we'll just take a certain amount balanced to keep you in a good range as far as your blood thickening, along with balancing out what your iron looks like.
Totally. So part of the game plan then is to find that sweet spot for you, get you dialed into it and keep you there without any of the negative side effects, but all the positive benefits of having an optimized T level, which is going to be energy, mental clarity, mood, sex drive. It's going to transfer over to potential gains in the gym in terms of your physical capacity, your physical energy, ability to kind of then put muscle mass back on, et cetera, et cetera. So lots of great upside to get your T level optimized.
And a couple more, sorry, just so I want to be very clear about the potential side effects that we really balance out is irritability. So this isn't one we have to watch for. So as that it can sometimes start, and for men, it feels very natural. It feels like, I'm just having a bad day. Like I'm like, somebody cut me off in traffic. And like, that person's annoying me. Like, and then it's your testosterone pushing that, right? It's just a little too much. So what I find, it's usually like a partner or someone that calls it out like, what the hell's wrong with you? Like, why are you so grouchy lately? And you go, oh, okay. That's what I tell my men. Like, that's what you're looking for. That means we need to dial that dose down, right? It needs to come down a little bit because you can still get your sweet spot without being grouchy. And then the last is acne. So some men it'll drive acne too. And then if that happens, the same thing, we just pull that dose down, and usually that takes care of it. So that tends to be it. So very minimal, manageable potential side effects, right? You might not get any of those things, with a lot of upside, including men over time actually that have good testosterone levels have decreased risk of like memory change, cardiovascular risk, stroke, heart attack.
Yeah, all-cause mortality probably goes down.
It does. Yeah, absolutely. So, and then, if you do end up having to deal with something, your recovery time, actually, they found it when men are in hospitals, the men who have great testosterone levels on a whole get out of the hospital a whole lot faster than the men who have low T.
Now, we've been talking a lot about bioidentical kind of hormone replacement / supplementation therapy. There are some other ways that we can go about, and we'll look at supporting and treating low T. Not always do we immediately go to testosterone therapy. It oftentimes is something, though, that men are curious about, they've heard about, they want to know more about. And with that testosterone therapy, before we talk about some of the alternatives to it, there's a couple different ways we can go about in delivering that. Why don't you speak to that?
Yeah, so we can start with DHEA, it's over-the-counter supplement. So that's what our body makes naturally, really well-tolerated supplement. And just really, the body will take it and convert it into testosterone and sometimes estrogen a little bit too. So we can do like a 25 milligram or like a 50 milligram. And that can be enough, along with, usually there's other things like stress and not sleeping. And so we have to address those too. Like when someone's well rested, which I know this one's the challenge, right? Like, as we're all so busy, then the T levels will come up. So there have been studies on deep breathing and meditation, that a very focused like deep breathing and meditation program can also make T levels rise. And so, yes, that's a really great point. Like, we don't always have to jump to, just going straight to testosterone. And because it is, it's a medication, right? It's something that you're committing to, and that you've got to, if it's a topical, you're doing it every day. If it's an injection, you're doing it. There's going to be a range, right? It's probably going to be somewhere between every 7 days to 2 weeks, just depending on where we land for you. So, there are men that go, you know what? I'm definitely willing to make sure I go to bed on time.
And clean up their exercise, or clean their diet, change their exercise modality up, right? Maybe we get some, there's hydrotherapy stuff that you can kind of use for
relaxing and healing.
So you could do saunas or cold plunges. I mean, all that kind of stuff. So you could definitely approach this from like a holistic lifestyle standpoint with the sleep, meditation, exercise, food, and some softer, more gentler modalities. And that could be a start, and give that a period of time, 3 months plus, 5 months, and measure along the way and see what happens if there's a response to your body on that. And that, that could be a possible way to adjust it. And for others, we might find that, getting into more of a direct hormone therapy is really the path they either want to go or the path that they need to go.
Yeah.
And when we think about that, like topical versus injections, it seems to me that injections are far superior to the topical.
I do find that. I know there are definitely men who are injection averse, right? They just really don't like the idea of doing it. And so we start with topical, and we just monitor and see how you do. But I agree. I think the potential for change and shift is greater with the injection.
Anything that we're able to inject directly into the body, it's gonna have a bigger impact. It's equivalent. Like if we were gonna do like a magnesium body spray versus we have magnesium in an IV nutrient supplement bag. I mean, it just gets into the system. It's completely, the absorption methodology is much faster. The effects are much more profound. So when at all possible, I think we're going to gravitate towards an injection basis if that's something that a person's able to handle.
Yeah, absolutely. And they can certainly come here or go to their medical doctor, to get their injection.
Or do it at home.
Or you learn how to do it yourself.
Yeah, it's an easy injection. It's not a huge needle. It's one of those tiny, smallish needles. Small like, depending on what
might be a little bigger than you think. But it's okay. tough, right? Like it's going to be just
Yeah,
fine.
you might start
Yeah.
off feeling like a little intimidated by it, but once those T levels go up, my man, you're gonna be feeling just like a bear in the woods. Like, give me that shot. I'm not scared of it at all. Little tiny baby needle.
That's right.
If
This.
you've had a good time on this podcast, and I hope you have had a great time on this podcast, but more importantly, if you're thinking this is something that either you or if you're listening to it, you're thinking of a partner, friend, family member, whatever is something they should hear, please share this. I mean, get the word out there. I think guys recognize the importance of tea in a very vague way, and we want that to be much more specific, clear, and crystallized for the men out there that are dealing with some of these issues and feeling like this is just the way it is. And I'm here to tell you, it does not have to be that way. There is a more powerful, more vital, more you version of yourself that's just waiting to be restored. And this could be part of the way that we get you there.
Yeah, I love that. Come see us. We'd love to see you, spend some time with you, get a really good grasp of your whole history and your goals, right? Where you want to be, like how you want to feel, work on your diet, work on the other supplements, let's create a comprehensive plan.
We're going to do all the stuff. We're not just going to give you like a
all
pill, a shot and say, hey, here you go. Good luck, Jimmy. No, we're going to do all the whole thing. It's the whole deal.
Whole deal. Whole meal deal.
Yeah, it's the whole meal deal. All right. We'll catch you on the next show. Until then, remember, folks, elevate and thrive.
Bye-bye.